David Wright, the Chief Operating Officer at Save the Children International. Thank you very much indeed for joining us and welcome.
Thank you for having me.
David, you had suspended operations completely in Afghanistan. I know that you've brought back some of those online. What had made it impossible to do your work?
Well, essentially, we just can't reach women and children without female staff. Afghanistan is quite a conservative society, and so you can't have access to women without actually having women on your staff. We provide life-saving services, most importantly, our health and nutrition mobile teams. And so we can't go into communities if we don't have mixed teams, men and women, on those teams. We were able to secure some local agreements that allowed our female staff back to work for health and nutrition activities, also for some education activities. And importantly, those agreements also allowed the back office staff, our female colleagues who are HR managers and finance managers who support those activities, to go back to work. And so our condition from the start was we would only restart activities, not just if women could be on the front line, but also the women supporting those operations can be supporting them from the offices. And we were able to get those agreements for certain activities.
Are you concerned still about their safety? Have the Taliban government given you reassurances?
So we tend to negotiate with the local authorities on this. So it's a case-by-case basis. It varies from province to province. Where we've done security risk assessments to ensure we're thinking of all the different things that can go wrong. We get assurances from local authorities. They can be written or verbal, or we can get sometimes they give us a phone number we can dial if we're getting into any trouble. So in no case do we send our female staff back to work where we are not assured of their safety.
I can only imagine that it's only a fraction of what you're able to do that you are able to do now, given the restrictions. What are the consequences for your inability to fully do your work?
So I think that's a great point, Peter. The fact is that Afghanistan is facing its largest humanitarian crisis in its history. It is currently the largest humanitarian crisis in the world. There are more than 20 million people in the country that are food insecure. The health and nutrition and education activities, they are important activities for us, but it is less than half our portfolio. A lot of what we do is livelihoods, and cash transfers are an important part of that. Last year, we gave out $16 million worth of cash transfers to some of the most vulnerable families in Afghanistan. The effect that has, these are often female-headed households with no other means of sustenance or income. That helps them keep their kids in school. Otherwise, we see negative coping strategies. So the kids might get sent out to work instead of going to school, or the young girls, maybe as young as 12 or 13, could be put into arranged marriages, which is obviously a very serious situation for them. So not being able to do those activities essentially means more people go hungry, more kids drop out of school, more young girls get married.
I think you've given us an idea. You mentioned some figures there, but let's focus a little on the children. What is the situation for children there? I know that, this is a country that's come out of a prolonged war and poverty issues. You've mentioned some of the religious issues that create problems for women, but for the children themselves, what are some of the consequences that you've seen, as a result of war and post-war?
So it's a very complicated situation because, of course, now there's a number of sanctions on the country, so it's hard for businesses to keep running. There has been a series of droughts that have compounded the effects of conflict and of political sanctions. So one of the obvious effects is, the massive amount of hunger that's there. So over half the population being food insecure out of a population of 38 million. We have about 70,000 children in our care. When I say in our care, I mean attending our nutrition clinics, because they are acutely malnourished. And of those, 30,000 are severely acutely malnourished. And thankfully, we've been able to restart our activities for those children, because if they didn't get assistance, there would be a 30% chance of those dying. That's the kind of standard statistic for children who are severely acutely malnourished. There's a lot of children not going to school. And of course, as we know, girls can no longer access secondary school, which is very serious, because, that's, you're talking about the potential of half your population there if girls can't get a proper secondary school education, and indeed a university education. Then there's a whole cohort of your population that can't fulfill its potential, can't be the future doctors, the future nurses, accountants, CEOs of the coming years.
Often where there's poverty and hunger, a desperation causes things like child labor. Is that something that you're seeing in Afghanistan? And I hear that there could even be children being sold.
The longer it takes for us to get back to the full suite of our activities, the higher the risk of children, being victim of what we call negative coping strategies, right? So you've got families who are extremely vulnerable. They literally can't feed all their children, so they look for solutions. So they might give one of the daughters to another family to feed by way of marriage. So then another family is taking care of them. They may send their children out to do harmful work, just so that they can bring in maybe an extra $1 a day to the household. So essentially, in order to be able to prevent those things from happening, the humanitarian community really needs to be able to operate at full throttle. And right now we are hobbled by the ongoing ban, and that essentially means that every day more and more children are succumbing to these harmful coping strategies.
We're talking a lot about pure survival issues, but I guess for children to go through war and some of the daily stresses, psychological issues must be playing out. A lot of children in need on that level, I'm sure.
There are, and a big part of our program is child protection. So where we provide child protection services, where we give children counselling, or we can refer them if they need deeper work. We can refer them. Those activities remain suspended. The longer the children suffering from those psychological problems are left untreated, the more deep they become, and the more likely it is to affect them as they're adults. So all this is diminishing the potential that Afghan children can reach and become full, productive citizens of the future Afghan society. So we really need an urgent resolution to this problem.
Save the Children have been in Afghanistan more than 4 decades, which is a long time. You've seen a lot of changes. When you look back at all of this, how difficult is the current period compared to even times during war?
Well, what was interesting about the first, I would say, 14 or 15 months after the Taliban took over is they did ensure that the whole country was secure. So we were actually able to access areas in Afghanistan that were previously inaccessible to us. And I was in Afghanistan myself last July, and we visited a village with one of our mobile health teams that even our local Afghan staff would not have been able to visit just a year before. And then I myself, as a Westerner, was able to visit there. So there was phenomenal improvement in access to women and children in the first 15 months. But unfortunately now with the ban, and which is coinciding with Afghanistan facing its biggest humanitarian crisis ever, access is very limited now. It was, of course, if we can't have female teams, we can't get access at all. And that was the case 2 or 3 weeks ago. But we really need, if we can rescind this ban on female staff, go back to working, respecting Afghan cultural norms, by having our female staff wear the hijab and so on. That would be the absolute optimum situation, which is exactly what is required right now when over 20 million people are going hungry.
This cultural aspect seems to be front and center of a lot of these issues. How does an organization like yours deal with perhaps the dynamic between male and female staff?
So we really do all we can to cultivate a sense of team. We have joint meetings. We also have meetings with just our female staff and with just our male staff, so that everybody gets a chance to express what's important to them. We are finding that male and female staff are super distressed by the latest developments. We have offered counselling to our staff. So we do everything we can to ensure that their well-being is at the forefront, because if you have a happy staff, you will have productive staff. But the best way of keeping them happy would be they're all committed people, so it would be to get them all out working with children once more.
So what's your call to the Taliban government and the local authorities going forward, and maybe even to the international community?
So our call is quite simple. For the Taliban, I think we have the same objectives when it comes to Afghan children. We both want the best possible thing for those children so that they can become productive adults in a future Afghan society. So there's no reason why we shouldn't be able to work together with the Taliban. We commit to respecting Afghan norms and values. And to the international community, we call on them to recognize that the mixed teams, male and female teams, are the only way of delivering effective, principled, and safe humanitarian assistance to Afghan people.
David Wright, we're going to have to leave it there. Thank you so much indeed for joining us. And let's hope that these issues get resolved so you can help the millions of children that desperately need the kind of care that you've been able to provide. Thanks for your time.